Hi Renee, it's Adam. It's a couple of minutes before 2 o'clock. And
I have been in the veterinary world for the past 13, 14 years in sales and currently represent a line of generic pharmaceuticals. Both my wife and I have a keen interest in the horses. We spend a fair amount of time at as many racetracks as humanly possible.
so this is Lindy and my Kentucky Derby program collection. This is every program from 1930 through this past May 2013.
I woke up, ironically enough, the night after the Ravens had won the NFL championship with stomach pains that I wouldn't wish on my worst enemy. And after rolling around in bed for several hours, hoping that it would go away, we decided it was time to make a trip to the emergency room. A short time thereafter, they sent me in for a CT, and after wheeling me back to the room I started in, it became fairly apparent to me that they found something inside. The nurse made a phone call for the attending, and he showed up what seemed like a minute and a half later. The first thing that went through my mind was, oh boy, there's a reason he got here so fast. He put his arm on my shoulder, rubbed it, and said, "You're going to be okay. We're going to do everything we can for you." And he said, "We're going to admit you upstairs. We found a tumor on your adrenal gland." No one had said to me at that point, or to us, "You have cancer," but certainly it was swirling in my mind. You know, nobody needed to say it to me, unfortunately.
Hi, buddy.
Hi.
Hi.
At the end of what turned out to be a fairly long day, I was ostensibly hooked up with Dr. Fraiman. I had a phone number on a piece of paper and a doctor's name. That's all I had. And I called, and they were, "Oh, Adam, we've been expecting your phone call. Of course, we're going to see you tomorrow. What time will be convenient for you, et cetera, et cetera." Having someone to tell me, "Yeah, come in tomorrow and we'll get started on this," was incredibly soothing at the time.
In his case, I just felt that we should do everything we can in our power to try to remove the tumor. He was having a lot of pain. He's a thin guy to start with, and the tumor was kind of growing into the side of his chest.
That first visit was really all about, we need to take it out. Here's how long it's going to take to get it out. Here's what recuperative time might look like. Here's what you can expect pre and post-operatively. And everyone here is here for you. And you're going to get through this. And that at the time, that was far and away the most important thing to me.
I felt that he was young enough to tolerate, a big operation, and he certainly removing his adrenal gland was certainly a big undertaking because it was adherent or stuck to other organs in the process.
Yeah, you're a good boy.
In the days between my diagnosis and surgery, we decided it was going to be a happy, positive day. We needed a little fun. We needed a little love. And so we put on our Ravens jerseys, our Super Bowl jerseys, and went to town hall and paid the $62.20 that you need for a marriage certificate, and got married in a very short but very sweet ceremony.
This is the wedding picture, and as they mentioned to us, we get what you pay for. We went to the courthouse in Towson and got married under some urgency.
He told me it was going to be a serious surgery, no beating around the bush. It's something that needs to be tended to immediately.
His surgery was a big deal. We did it in the cardiac surgery room, and we had a cardiac surgeon on standby. And we not only removed his right kidney, his right adrenal gland, but we also removed a part of a significant blood vessel called the inferior vena cava. It's a part of the vena cava that sits behind the liver, so we first had to move the liver, disconnect the liver from the vena cava, remove it with the tumor, and then sew an artificial piece of tube graft. So he has an artificial conduit that replaced his vena cava.
Surgery went smoothly. It went great. I walked out of the hospital about a week earlier than expected.
This is Orbit the pig.
They do know it was an aggressive cell, and post-operative treatment has been determined accordingly. He put me in touch with the oncologist that day on the phone, called him on his cell phone as we were sitting in his office. And it wasn't, stay here, I'll be back in 20 minutes. Okay, you know, here's a phone number, call a phone number. It was, hey, Rich, how you doing? It's Mark. I've got a new patient here. Here's what we found. Here's the surgery we did. And I'd like to get him over to see you just as soon as you possibly can. And it was important to feel his sense of urgency without being distraught. It was about the timing. It was about the attitude. It was about the accommodation. It tells me that his goal is my getting better, and my getting better just as fast as is humanly possible. And it would be hard to ask for anything more than that. I couldn't have dreamt the process to be any smoother from one point of caring to another. And it was just very nonchalant. Hey, this is what we're going to do. This is how we do business here, and we're going to get you taken care of. They acted quickly. They acted with grace and kindness. They gave me my life. It's all worked out really, really well. Couldn't be happier.
The Liver and Pancreas Center. Hope. At the University of Maryland, St. Joseph Medical Center.